Hi, my name is Nia and today I'm going to be demonstrating how to apply sterile gloves. The first step is going to be ensuring that the package is intact. You just want to make sure there's no tears and also that the package is not wet. After ensuring that the package is intact, I want to perform my hand hygiene. And while performing my hand hygiene, I just want to check my fingernails and my hands while performing this, just to be sure that I don't have any dirt, debris under the nails, and make sure my hands are as clean as possible. After doing that, what I'm going to do is I just want to make sure that once the gloves are applied, I don't touch anything else besides the patient. Once that's done, now it's time to open the package. So I'm going to open the package, and on the inside there's these two inner folds. You want to open the package by these folds just to ensure that you won't touch the gloves on the inside. And also you want to keep in mind that the outer 2 inches here are okay to touch. Now it's time to don my dominant hand, which is going to be my right hand. So what I want to do is to don my right hand, I'm going to just take my non-dominant hand and place it on the cuff. And just make sure you have your hand on that cuff. And you want to take your dominant hand and kind of squeeze your thumb through the inside so it'd be easier to apply the glove. And you just want to get it all the way on. And once that's on, now what you want to do is you want to do the same with the other hand, which is going to be your non-dominant hand. But this time you want to take your dominant hand and put it underneath the fold. Once you've done that, you want to do the same technique that you did with the dominant hand. Once that's applied, what you want to do is you want to interlock your hands just to make sure that they're snug and tight, and you just want to have that tight fit on your fingers. Now what I would do is I'm going to discard of the packaging, and what I'm going to do is going to hold it from the inner side and I'll discard it into the trash can. You want to hold it on the inner side because that side is still sterile. So after you've done that, what you want to do is once you've done everything with your patient, you've done your wound care or whatever the doctor has ordered you to do, what you want to do now is you just want to make sure that you remove the gloves. So what you want to do is you want to remove your gloves. So to remove your gloves, you want to remove it from your non-dominant hand first. And place it on the inside of your dominant hand. Next, what you want to do is you want to remove the glove from your dominant hand. And now that you see that everything is on the inside. So now what you can do is you can discard of those gloves into the trash can. So now the last thing that you want to make sure is you just want to discard, of course, of all the contaminated, of both the contaminated gloves, and just make sure everything is thrown in the trash can. And now you want to perform some hand hygiene again. And after you perform your hand hygiene, you just want to make sure you document before leaving the patient's room. And that is how to apply your sterile gloving.